Did you know that the most common of all deformities in newborns are ear deformities? Remarkably, as a Baylor University study shows, 25 to 35% of newborns have ear deformities. Unfortunately, the standard therapy for most ear anomalies is to have the infant wait until the age of 5 to 6 years, at which time a plastic surgeon would perform corrective surgery. Unfortunately, the parents face a costly surgical option, and their child may suffer years of teasing from other children that is often a result of any facial deformity. There is, however, an alternative, an early intervention that will help parents and children avoid these undesirable consequences. We are proud to introduce the EarWell Infant Ear Correction System, which provides an immediate non-surgical remedy for most ear deformities. The EarWell Ear Correction System can be immediately applied to any infant's ear that exhibits a deformity. Usually within 6 weeks, the ear will be transformed into a normal shape. The EarWell can be applied in the office in less than 20 minutes. It is painless, requires no anesthesia or sedation, and is over 90% effective. In addition, the EarWell Infant Ear Correction System is insurance reimbursable, providing a significant additional revenue stream to your practice. You will find the EarWell system to be easy, safe, and rewarding. The key to success is early application of the EarWell system. The following video will show you how to correctly apply the EarWell to an infant's ear. There are many types of ear deformities that the EarWell system can correct. These include cupping, lidding, lop, prominent, stalls, tanzer, and helical compression. But don't worry, an exact diagnosis is not important. The EarWell system is applied in a standardized protocol to treat all of these deformities. First, let's look at what the EarWell system contains. The kit includes cradles, 8 sets of medium cradles, 8 right and 8 left, 4 sets of large cradles, 4 right and 4 left, an EarWell kit box, large, medium, and mini retractors, conchal formers, alcohol wipes, acetone alcohol wipes, EarWell forceps, hair trimmer with battery, micropore tape, instructional training video, retainer tape, instructions for use, parent instructions, and a conformer guide. Please note that the latest information about kit contents and instructions are available on Beacon Medical's website at www.beaconmedical.com. There are 6 steps to apply the EarWell. Before you begin, however, make sure that the baby is calm and quiet. If the baby is crying, restless, or agitated, consider swaddling or using a pacifier. First, trim the hair around the ear. Use the battery-operated trimmer that is included in your kit to cut the hair from around the infant's ear. Cut to about ½ centimeter beyond the perimeter of the posterior cradle. Be thorough in your trimming, since successful adhesion of the cradle to the skin is predicated on a smooth surface to which the posterior cradle is applied. Remove any loose hair from the skin surface before proceeding. Second, prep the skin with alcohol. Use alcohol wipes to clean the area. Generally, 2 packets of wipes per ear will do the job. The alcohol will remove the natural oils in the skin, allowing the EarWell to bond more effectively. You may notice that some infants will cry because of the cold and wet alcohol. Permit the alcohol to dry thoroughly for a minimum of 30 seconds before proceeding. Third, apply the posterior cradle. The posterior cradle can be thought of as the foundation to which all of the other components of the EarWell system attach. All of the forces that are applied to the infant's ear are associated with the posterior cradle. Therefore, positioning the cradle is the most crucial step. Check again to make sure that the baby is calm before attaching the cradle. Pull the ear through the cradle and set the cradle against the skull. You may wish to use a cotton applicator to help manipulate the ear through the posterior cradle. After the ear is passed through the posterior cradle and the cradle sits on the skull, lift the ear and make sure that the posterior conformer on the posterior cradle rests near the retroauricular sulcus of the infant's ear. The posterior conformer should be oriented so that it is in line with and parallel to the upper third of the sulcus. It will exert forces on the ear to help shape the antihelix and the superior limb of the triangular fossa, a key to correcting the shape of the upper third of the ear. Make sure that the posterior conformer does not touch the sulcus. Allow a millimeter or two of space between the conformer and the sulcus for growth. Once the posterior cradle is correctly positioned, remove the adhesive liner that is at the bottom of the cradle. This will expose the adhesive surface. You'll find that the liner backing is split into two pieces and that there are two tabs to assist you in their removal. Most physicians like to remove the liner that sits in front of the ear first and then proceed to remove the liner that sits behind the ear. It doesn't matter which order you follow. After the liners are removed, make sure that the posterior cradle is fixed securely. Use your fingers to press all parts of the cradle, including the adhesive footing. Fourth, apply the retractor. The retractor will exert lateral forces on the ear, forming and guiding the helical rim into a normal shape. The retractor will also exert downward forces to control overprojection of the antihelix and will deepen and shape the scapha. Take out a retractor from the kit. You have several sizes from which to choose. Typically, the medium retractor is used with the medium cradle, and the large retractor is used with the large cradle. You will notice that there are mini retractors included in your kit as well. Mini retractors are used to help shape very large ears. A mini retractor can be used in conjunction with a medium or a large retractor to add additional forces to the ear if needed. Use a retractor or a combination of retractors that most closely match the size of the helical rim of the infant's ear. Bend the medium or large retractor so that it contours to the desired shape of the helical rim. Position the retractor over the helical rim. Be sure to position the retractor so that it does not overlap the posterior conformer, as this may cause unwanted pressure. You can lift the ear to visually confirm that the retractor does not overlap the posterior conformer, or if you are new to the EarWell system, you may wish to use the conformer guide to ensure proper placement of the retractor in relation to the posterior conformer. Once the retractor is in proper position, insert the helical rim into the retractor. The retractor should now cup the helical rim. Finally, remove the liners on the inside of the posterior cradle to expose the adhesive and attach the retractor to the posterior cradle. Note that there are two adhesive strips, one horizontal and one vertical. Press the retractor so that it will adhere to the adhesive securely. Fifth, insert the conchal former. Now you're ready to place the conchal former into the conchal bowl. The conchal former will exert downward forces to correct a conchal crus, deepen and shape the conchal bowl, and correct the prominent, over-projecting concha. Make sure that the opening of the conchal former, which is visible on its vertical shaft, faces forward so that it does not obstruct the opening to the ear canal. Note that the conchal former should exert vertical pressure onto the conchal bowl when the anterior cradle is applied. There are two conchal formers provided, one with foam and one without foam. Typically, the conchal former without foam is used during the first cradle application, and the conchal former with foam is used for subsequent cradle applications. Occasionally, at the first cradle application, the conchal former without foam may rest too low in the conchal bowl to reach the anterior cradle. To correct this situation, simply remove the conchal former without foam and replace it with the one that has foam. This will increase the height of the conchal former, allowing the anterior cradle to exert the necessary downward pressure when it is applied. Sixth, applying the anterior cradle. The anterior cradle will protect the internal parts of the EarWell system, as well as exert downward pressure on the conchal former. It also helps to maintain the ear's position throughout the treatment regimen. You will notice that there are male tabs on the anterior cradle and female slots on the posterior cradle. Orient the anterior cradle over the posterior cradle so that the male and female parts align. Then merely insert the male tabs of the anterior cradle into the female slots of the posterior cradle. Physicians usually like to engage the tabs in the front of the ear and gradually work around to the back of the ear. After attaching the anterior cradle to the posterior cradle, make sure that there is contact between the conchal former and the anterior cradle. As noted earlier, the anterior cradle should lightly push the conchal former downward into the conchal bowl. If you use a conchal former without foam and there is a gap between the anterior cradle and the conchal former, simply remove the anterior cradle and remove the conchal former. Then replace the conchal former without foam with one that has foam to increase its height. Finally, reapply the anterior cradle. Once the anterior cradle of the EarWell is applied, inspect the ear to be certain there is no blanching. Blanching means there is too much pressure on a portion of the ear, and you can easily spot this. In order to relieve the pressure, simply raise the anterior cradle slightly. Subsequent applications. Because the epidermal layer of skin turns over quickly in an infant, the EarWell will usually start to dislodge after approximately 2 weeks. Instruct the parents to monitor the cradles daily. As soon as they observe the adhesive beginning to separate from the skin, they should temporarily tape the cradle with a piece of micropore tape supplied in your kit and call you for an appointment. You will need to apply a second EarWell at that time. Beacon is constantly updating the adhesives on the EarWell, so refer to Beacon's website to read the latest recommendations. When the infant is ready for the next EarWell fitting, you will need to do the following. First, remove the anterior cradle. Simply detach the anterior cradle from the posterior cradle. You can do this with your fingers, or you may use forceps. Second, remove the conchal former. Once the anterior cradle is removed, you can easily lift the conchal former from the concha. Third, remove the retractor. With your fingers or with forceps, remove the retractor. Fourth, apply acetone alcohol to loosen the posterior cradle. Place several acetone alcohol wipes underneath the posterior cradle in order to dissolve the adhesive. Allow a few minutes for the wipes to do their job. Once the adhesive is dissolved, gently remove the posterior cradle. Remove any residue adhesive from the skin and hair with acetone alcohol pads. To ensure optimal adhesion for the new EarWell, use an alcohol wipe to thoroughly remove any residual acetone from the ear and from the skin behind the ear. Allow the area to thoroughly dry before proceeding. After the old EarWell is removed, you are ready to apply a new one. Inspect the ear and the skin around the ear. You should begin by retrimming the hair to approximately ½ centimeter beyond the perimeter of the posterior cradle, and then proceed with the application steps described earlier. Very rarely an ear deformity will require extended treatment. If a parent calls after the final EarWell cradle set has been removed to report a relapse, simply apply a retention tape that is supplied with your kit. The retention tape is a crescent-shaped double-sided adhesive tape. First, remove the liner on one side of the double-sided tape and position it onto the skull behind the ear. Have the crescent face into the ear. Next, remove the top liner and press the ear onto the exposed adhesive so that it will be held in place. The retention tape will hold the ear in proper position for an additional 7 days. Supply the parents with a second set of retention tape, instructing them to apply the new set when the original set begins to come loose from the skin. Parents will be relieved and grateful for an application that can correct their infant's ear deformity at this young age, painlessly, effectively, and inexpensively. As a physician, you will have invested minimal procedure time and obtain the gratification of knowing that you have corrected a problem. In addition, you will receive a considerable revenue contribution.